I think I was like 14 or 15. I was definitely in high school, and my periods just got really, really long and really painful. Like, they would last more than a week, and I couldn't get out of bed. Like, I wasn't going to school that week.
Sarah is a student at Boston University. What makes Sarah different than other girls her age is that she has endometriosis. Endometriosis is a disease that affects the female reproductive system. It is when the cells inside the uterus grow outside of the uterus, causing severe pain.
The endometriosis, you kind of have all that extra stuff flying around, went into my bladder and gave me like a mondo bladder infection, which then was drug resistant, and my gynecologist really didn't take it all that seriously at the time.
Dr. Mark Lawfer, one of the top doctors in the field, says that there is a gap in the diagnosis of endometriosis.
There is a problem that not all gynecologists are comfortable treating adolescents, and not all pediatric surgeons who operate on adolescents are familiar with endometriosis.
Eventually, Sarah was prescribed various medications in addition to physical therapy with a doctor.
So, like, it was crazy. I actually have some of my tools that I had to do my homework with. This is how effed up my muscles were. I promise they're, like, not sex toys. But it's like this. And I have basically lube and different sizes. So this one is the smallest one. And then this is the biggest one, which I'll be honest, I never did ever because it's terrifying. And you have to like insert it and do some kind of like massaging on the muscle walls, like the same way you would massage a tense muscle in your leg, and sort of have it inside of you for like 10 minutes with each size, so that your muscles would learn to be relaxed around it. And that's how your muscles would get better.
One result of endometriosis is infertility. However, this doesn't bother Sarah.
I've been in so much pain in that area that nothing about being pregnant sounds worth it to me at all. Like, it's made me not want to have kids. I would rather like focus on my career and be really successful than ever be that sick again. So I'm kind of like horrible pain for a child that might turn into a drug addict or just not having kids.
For now, Sarah is trying to stay healthy and stay out of the hospital while maintaining a positive outlook.
It's definitely helped me realize that certain things aren't the end of the world. Like, if I get a B on one of my midterms, I've come up from a D before, so raising that B isn't a big deal. So I definitely don't take things as seriously, and I definitely try not to let myself get stressed out, because that can sort of put a damper on things, hormone-wise and muscle-wise.
For more information on endometriosis, visit Children's Hospital Boston at childrenshospital.org.